How you doing out there? This is Dr. Lewerenz, Longevity Health Institute. Today I'm in my Bingham Farms office, which is our west side office here in southeastern Michigan. We always have two locations, of course, Rochester and Bingham Farms. But today I'm here, had a great success story that I wanted to share with you and educate you on. And you've heard me talk before about peptides. Peptides are a new therapy that is excellent in functional, regenerative, personalized medicine. We have encompassed these here for the last couple of years, and I love using peptides because they really can impact your quality of life, do a lot of regeneration and anti-inflammation and healing. So let's get into it, and I want to talk specifically about a peptide that is a GLP-1, and that type of peptide is great for weight loss and also people that are like insulin resistant and for sure a diabetic, okay? But let me first back up and talk about a little bit what a peptide is. So a peptide is, I always say, people understand what proteins are essentially. So amino acids make up chains of amino acids, make up peptides, and many peptides make up a protein. So that's it in a nutshell. And when they do in the laboratory put a lot of these amino acids together and make a peptide, they can do wonderful things. And a GLP-1 has a lot to do with how your body sensitizes insulin and how it utilizes it. Nicely, GLP-1s also have an appetite suppression and it really help people with weight loss besides making them very successful in weight loss. So it's all the rave right now, this type of peptide. We personally like to use semaglutide, and I'll share with you why in a second, but they really can help you, and studies show about 15 pounds of weight loss after 3 months. I'll tell you, we see anywhere from about 10 to 15, sometimes even some cases 20 pounds, because you have to remember we take a functional approach and look at your health foundation here, where we're really digging into our 6-point model, because weight is 4 things. It's diet, not just diet. So it's diet, but not just diet. Okay, so it's calories in and calories out, but it's also your hormonal balance, and balance is key, very key when you're talking about weight. And about 20 to 30% of your metabolic rate is your gut health, your digestive lining, and how you detoxify. So you have to, especially with aging and how we get some organ aging, you have to appreciate all 4 of those systems. But if you are insulin resistant or pre-diabetic or diabetic, okay, and you have, usually we say anywhere from 20 pounds or more to lose, okay, a GLP-1, and the one we use, like I said, is called semaglutide. That peptide is wonderful. Now this peptide is dosed once a week. It is a sub-Q injection. It's very small, and I mean very small, like eyelash, hair-like needle. If you close your eyes, I always tell my patients, you wouldn't even feel it. I wouldn't even think about it. And because even our patients that have needle phobia usually can do it. And again, it's once a week. You do get a little bit of nausea or a little bit of stomach issue sometimes for 24 hours. That can happen in about 20-30% of the patients. But what's nice about the peptide we use that is compounded, that's a personalized dose that you weekly escalate, only once a week you have to do this, it is joined with a peptide that's called BPC 157. That peptide is wonderful for gut health, for inflammation in your body. So not only are you getting the semaglutide, but the BPC 157, and that combination actually we find is wonderful for you getting actually a whole regenerative anti-inflammation ability in your body, and it protects your gut lining, okay, which then some of that nausea and stuff is not any of an issue. And I can tell you to date, we've had great success with multiple patients that are on this 15 to 20 pound weight loss journey, and we're seeing those results. Now, of course, it takes that 4-point model too, and working with your diet and our nutritionist and really dialing in your diet, okay, your macros and micros and what you burn. But this can be an added assistant to really get you over that. And I love the fact that it's got a little bit of appetite suppression, because patients often struggle with that until they get into about week 3, and then the fact that they're eating less becomes more of a norm and a lifestyle that doesn't really bother them. So hopefully that educates you and gives you some incentives to try this peptide, this wonderful peptide called semaglutide, GLP-1 inhibitor. And again, we put that in with BPC 157. Here at Longevity Health Institute, We can always help you with personalized compound approaches to wellness, to regeneration, to health, okay, so that you can live optimally and thrive, not just survive. This is Dr. Lewerenz. Keep loving each other. We need it. Be well.